who have been associating with us for mainly health program exchanges. Today they have come forward to help all our housekeeping staff, faculty members to have a free health camp today.
Good morning, students. अरे नर्सरी क्लास में जो सिखाया था वो बोल रहे हैं? Yes. बचपन में जो चीजें सिखाई गई हैं वो बोलनी नहीं है, नई नई चीजें सीखनी है, लेकिन पुरानी चीजों को भी याद रखना है. Good morning. So I bring you greetings and regards from the Mahatma Gandhi Medical College and Hospital, which is a unit of the Mahatma Gandhi University of Medical Sciences and Technology. So the university has several colleges other than the medical college. We have a dental college, nursing college, physiotherapy, occupational therapy. The one which may be of interest to you would be a college of hospital administration, which offers graduate and postgraduate courses. An institute of health informatics, which offers courses to students both from biology and mathematics stream. So these are some courses which we offer to even those who are not in the biology stream. The hospital is a medical college hospital. That means that we teach and train doctors not only for their MBBS degree, but the second level, which is MD or MS, and the third level, which is DM or MCH. And we are a 1500 bed hospital, tertiary level care. In the next year, we are going to add another 1000 beds because next year is our silver jubilee year. But when we work in the hospital, who comes to us? It is a patient. Who is the patient? Patient is a person who has a problem, who has a disease, which is a very small fraction of the entire population. But some of us felt that even the remaining people who have no disease, who have no symptoms, who have no problems, they are not aware of what are the early symptoms of disease, which means that they come to the hospital or they bring their relatives to the hospital when the disease is advanced, when it has gone into a stage where the outcomes are not very good. And also, we felt that many of us, and I would say most of us, are not aware of health. What is good health? So we thought, in addition to treating patients who come to us in the hospital, we will go to you, the community, the population, the lay people, the so-called, within inverted comma, healthy people, and make them aware of what is health, what is good health, and very importantly, what are the early symptoms of any disease. Not in you, you are all young people, healthy people, but in your parents, in your grandparents, in your uncles and aunts at home, so that you can suspect that there is something wrong with them at an early stage and bring them to us at that stage so that treatment is easy, it is less expensive, and the results are better. So with that aim and intention, we started this series of interactions with people which we have named Jaipur Swasthya Charcha. And as you see, this is our 40 plus session, and we are slowly moving towards our golden jubilee session. So as was introduced, I am a surgeon, surgical gastroenterologist, which means that I operate upon the tummies of patients. So I know only about my own specialty, and I'm sure none of you would need an operation at least for the next couple of decades. So why am I here? I am here only to introduce my team to you, to introduce this concept to you, and maybe make one or two comments in between. But the session will be moderated by my colleague, Dr. Priya Marwa. She is a pediatrician, a child specialist, but she is an expert in a very special procedure called bone marrow transplant. I won't go into the details. बाद में अपने मोबाइल पे check करना what is bone marrow transplant. It's a very special procedure. She is an expert in that. So she is going to moderate the session, and I have a team of experts. Dr. Lalit Mohan Sharma is a prominent and eminent oncologist. Oncology means those doctors, specialists who deal with cancer. So he is a cancer specialist, and he has a vast experience of such interactions with people. He's conducted many such health talks, and he's a very important part of Jaipur Swasthya Charcha. Then I have Dr. Priyanka Goyal. She is a gynecologist and obstetrician dealing with diseases of women and the event related to pregnancy and delivery. And I have Dr. Mahatma. She is a clinical psychologist. Who are clinical psychologists? They get into our brain and they know what we are thinking and what we are planning and what we intend to do. So she's a very important person. Stay away from her, otherwise she will get into your brain and she will tell father what mischief you are planning today. So with that, and I, sorry, Dr. Anchin Kalia, who was to be here, actually she came up to your stairs, but then she received a call that somebody very close to her, a good friend of her husband has some emergency issue, so I requested her to go and attend to that. But we will cover the topics which she was to cover. And this panel I have chosen especially keeping you people in mind, the young adults. So as I said, presumably you are all healthy, you have no disease, but you need to know about health and disease not only for yourself, as my experts will tell you, but also from the point of view of.
So good health always we feel 6 so इधर उधर बहुत अच्छा मांस दिखे, मसल दिखे, that is good health. Actually, that is only physical health. So the health, one concept is it is not merely absence of disease. Common man feels, why should I go to a doctor? I don't have any problem. I am absolutely normal. So one feels normal, doesn't go to a doctor. So the good health is not merely absence of disease, but it is like mixture of your physical health, mental health, your social health, your emotional health, spiritual health. So all these are various components of health. So it's a mixture of having all these balanced together that is considered as good health. So that is again variable. Sometimes for emotionally somebody is not so strong, somebody is spiritually feeling difficulties. So all these are mixture of good health.
Dr. Lalit, we often hear the term body mass index. BMI hai, kitni hai hamari. So what exactly is BMI? And please explain us the ranges of BMI signifying different health issues.
So are in fact BMI indicates towards the healthiness or towards the obesity component. How one is obese or one is overweight. So these are different categorizations. So roughly for all of us to understand that how much weight one should have is your height in centimeters minus 100. So that remains much better way to understand the exact weight. If my height is 165 centimeter, my weight should be 65 kilos. So that remains a better way. BMI needs little more calculation and sometimes it is much more confusing. But in science, BMI is much better.
Yes. And addressing the issue of obesity, which is quite common, what are the problems that are associated? Because people often say, weight is not important, it is the fitness that is important. But obesity itself has many complications. So if you could just talk about a few of them.
So obesity, in fact, like we consider, भारत में obesity बहुत rapidly बढ़ती जा रही है. It is becoming like every second or third person is obese these days. The overweight obesity leads to many problems. It is not one disease. It comes as a package. And especially in young children, in your age, obesity leads to long-term complications. During the childhood, people feel गोलू मोलू अच्छा लग रहा है, बच्चा हमारा चबी चबी अच्छा लग रहा है, but long term, almost 70% of the children, they will have permanent obesity in the adulthood also. And that leads to a lot of cardiac disease, heart attack, heart disease, hypercholesterolemia, fatty liver, joint problems, cancer-related problems. All these are in fact like associated with obesity. We see a lot of cancer in men and women which is associated with obesity. Obese person will have more of inertia. They will not be able to walk properly. So when they do not walk, again the cholesterol will be deposited in the blood vessels, in the liver, in the heart, will lead to early heart attack, will lead to joint problems. We are seeing that after the age of 45, 50, a lot of people, they find joint problem and they get the knee replacements. So all these are like associated problems. So obesity is one like a package and a baggage for many diseases coming together.
And of course, there are many publications that prove that, adolescents who are overweight or obese will tend to be overweight or obese adults. Dr. Lilith, there is another common problem in adolescents and young adults that we are addressing today, and that is anemia. People don't really realize that they are anemic. They sometimes come back home feeling very tired, though they have not had a very, I would say, physically active day. So what is the cutoff hemoglobin that we are looking at, and what is it that these young adults should include in their diet to take care of, anemia that could be there?
So anemia is basically low hemoglobin. You all know our blood is red because of hemoglobin. So hemoglobin should be more than 12 in boys and it's more than 11 in girls. There are different definitions and cutoffs for various age associated also, but in general we should feel that boys should be more than 12, 12.5, girls should be more than 11. Anemia in childhood is very, very common. Every second child is anemic. The hemoglobin is less than the standard available to us. Less than 5 years, 2/3 of our whole population is anemic. Less than 5 years age group, 2/3 of the population is anemic. And this anemia leads to low concentration. They are not able to focus on their studies. They are not able to take part in active games also. And that leads to e.g. fatigability, not able to concentrate well, lack of memory, lack of physical endurance to do anything. Their height is stunted, their growth is stunted. So all these factors are there. Why one develops anemia? Mainly because of lack of the iron containing food. Modern generation, our own kids, they eat more of cake, pastry, pizza, cold drinks, all these things are there. So this all leads to lack of iron. We do not eat proper nutrient, and especially even if we are eating little bit, if you keep adding and pouring the cold drinks and lot of tea, coffee and other things, that leads to lack of the absorption of iron. So we are taking, but it is not getting into the blood formation. So these are the common symptoms of anemia. To correct the anemia, we need to keep eating dark leafy vegetables too much. Then we need to keep taking fruits. With the fruits, iron-rich fruits are like apple is one good source. The khajur is also another good source of iron. So we need to take that. If somebody's hemoglobin is low, especially pertaining to females, they might be having excessive menstrual blood loss. So they may need a gynecological consult, or sometimes therapeutic iron treatment also is needed. So with the help from doctors, one needs to take treatment of iron deficiency anemia. Iron deficiency is commonest cause of anemia. If somebody is not getting recovered, it is better to get proper checkup for that.
So you talked about fast food like pizzas and burger. Is it a total no-no, or are we allowed sometimes?
I think Dr. Priya has done a lot of research on the fast food, cold drinks, junk food. So Dr. Priya, you only highlight about the importance of that.
Thank you, sir. Being a pediatrician, I think this is a very common question that parents ask me. क्या बच्चे को टॉफी दे सकते हैं? क्या कभी कभी हम पिज्जा बर्गर खा सकते हैं? Of course, you are allowed to eat, but we've got to practice moderation in our eating habits. Lunch, रोटी दाल सब्जी का सब्स्टिट्यूट नहीं होना चाहिए पिज्जा बर्गर. Samosa should not be a major ingredient of the breakfast. So look for fiber, a lot of fiber in your diet. Look for a rich protein diet. I usually recommend, some people say, once a month is enough. I say once a week is allowed. Once a week junk food is allowed, but don't, eat it in place of your regular meals. So practice moderation and we can enjoy both home cooked food and our so-called fast food or junk food also.
I'm very happy because I like pizza and burger very much. So I'm going to go back and tell Mrs. Kapoor that Dr. Priya has allowed at least once in a fortnight or once a year.
I think so that much is allowed. Dr. Sharma, I wanted to ask you one more question. You know, when we were young, very early 70s Hollywood movies, we used to talk about all brawn and no brain. There used to be this very common dialogue about those handsome hunks who used to be the heroes of the movies. I see that youngsters today are also, frequenting the gym, as you talked about, the six-pack or ye sari cheezein. Now, one of the, very, I would say, challenging factors in gyms are those protein supplements that are displayed so attractively, the moment you enter the gym. Would you recommend this, or are they even, allowed as far as RDA is concerned? And what can be the complications if we take these without any physician's prescription?
I think that is very, very relevant for all of us to understand. The protein powders, which are at least 5 kilos much more seen than 1 kilo packet, and they claim a lot of ingredients leading to boosting up of the immune system, boosting up of your endurance, health, muscle mass, that all most of them, they are not for common men. They should not be taken without advice of a doctor. All these advertisements leads to very lucrative offers in fact. And whenever we see we are tempted to use all these things, many of these ingredients, they have heavy metals. Many of them leads to kidney failure. Many of them leads to other chronic problems. So sometimes person comes to us with other problems, and when we investigate, we don't find anything abnormal. The boy is looking good, healthy, but there are a lot of other problems. So this all is dangerous thing, the protein powders. Unfortunately, the advertisement by the company, which is such attractive that every youth feels that if I take this dabba, I'll be very happy and healthy. So we should avoid that part. You should keep taking good amount of proteins. So the protein content should be in the form of vegetarian source, mein paneer, dal, chana, mungfali, rajma, soya bean. All these are good source of protein. If you are taking non-vegetarian, then of course the fish, meat and the eggs remains one important source of protein. So our diet should have at least 1 gram of protein daily, and we should take it judiciously. Problem is that we do not take adequate proteins, and we want to supplement with the protein dabba available in the gym. So that is very dangerous. I request, appeal all the youngsters not to consume these protein dabbas. They all claim that ours is the best, but we do not, as doctors, we do not recommend to all of you.
Thank you, sir.
So, Dr. Lalit said it very mildly. I'm going to put it in very strong words. Anybody who is able to take a normal diet does not need these supplements. If the gym owner insists that you will be allowed to use the gym only if you buy these products, say no to him, go to another place.
Thank you, sir. See, body shaming has become very common these days. This is a topic, of course, Dr. Mehek will deal with. What we are trying to tell you is, everyone's body shape is very different. So all of you boys cannot strive to be, strive to have a body like Hrithik Roshan or Salman Khan. All of it depends on our genes that we have inherited from our parents, and a lot on the body structure that we have. A stocky young man cannot hope to have a body structure, like a 6 feet tall Hrithik Roshan. So try to understand that what is important is whatever you have to ensure that you are fit and you are healthy. So Dr. Priyanka, I'll now come to you. We have a lot of young ladies here also. All these kids are basically young adults, so they've actually crossed the pubertal changes, age group. But I would still like that, if you could address what exactly are the pubertal changes And when should these kids be worried, whether it is delayed or is it too early? So just a few words about pubertal changes.
Good morning, everyone. What is puberty? I think यहाँ पर जितने भी students हैं, you all have crossed that puberty. But for just an introduction, for boys, the changes of puberty like change in their voice. There is a little deepening of voice. Then they start getting the mustaches, the beard, the hair, and there is an increase in the height that we call it as a pubertal spurt. Okay. And for the females, first of all, they start noticing the development in their breast. There is the increase in the size of the breast. Then they start getting the menses, what we call the periods. Okay, and the hair pattern also gets start like pubic hair or axillary hair. We start getting. If there is a delay in all these features, like we call them as secondary sexual characteristics. Okay. So secondary sexual, these all start with because of the increase in the hormones. Like in females, there is a hormone, we call it as estrogen, and in males, testosterone. So whenever there is an increase in these hormones, these secondary sexual characters start developing. So if in any female, like secondary sexual characteristics does not develop by, you can say 13 or 14 years, or menses do not start by 16 years, then there should be, you should get a checkup by a doctor. There can be a constitutional delay also. It all, sometimes the menarche and thalarche, they all depend on the hereditary also. कि मम्मी को या sister को late period start हुए, तो females को मतलब hereditary होती है इसमें. But yeah, there is a deadline after which you should get a checkup done by a gynecologist.
So the reason we are talking about these things is because you may have younger brothers or sisters at home. And as young responsible adults, I'm sure you should know, when would be the right time to take your younger siblings, for a medical checkup. Dr. Priyanka, PCOD, a very common term we hear these days and a very common problem amongst the girls. Could you please explain to the girls about this?
Yes, ma'am. PCOD, अगर हम इसकी बात करें, what is PCOD? It is polycystic ovarian disorder. What do you mean by polycystic ovarian disorder? If we understand a menstrual cycle, because of the changes in the hormones, we have two hormones in females. One is estrogen and one is progesterone. Both of them are secreted by the ovary. So in a cycle, there is a development of many eggs. Okay, one of them gets matured and which gets ruptured during the mid cycle, that is say around 14th day. So whenever it gets matured, भगवान ने एक mechanism दिया है, because once puberty gets achieved, once the female starts menstruating, after that a female has the capability to conceive, to get pregnant. So whenever the egg ovulates, if the pregnancy doesn't occur, it gets shed off. The endometrium, the uterine lining, which is prepared to achieve the pregnancy, it gets shed off in the form of period. So because of certain hormonal disturbances, if it doesn't happen, like there are multiple factors which I'm talking about, which I'll be talking about which is the reason of PCO. So if it doesn't happen, the eggs doesn't get mature. There are multiple cyst formation occurs instead of one mature egg. So the ovulation doesn't happen, because of which the uterine lining is also doesn't get prepared and you don't get menses. The menses becomes irregular. So first of all, sign symptoms क्या होते हैं PCO के? PCO के you don't get your menses regularly, जो महीने पे आने चाहिए, the menses should come every month. You don't get your menses regularly, you get irregular periods, and you don't get pain. The painless cycles, the irregular painless cycles are a sign and symptom of PCOS. ठीक है? अब reasons क्या क्या हो सकते हैं? First of all, जैसा सर ने बोला, एक root cause जो है, which is obesity. तो obesity की वजह से you get it is a vicious cycle, अगर obesity हो गई तो periods irregular हो जाएंगे, तो उसकी वजह से बहुत सारे ऐसे male hormones बन जाते हैं body में, which again leads to irregular periods and obesity. So these obesity, now what is the reason of PCO? Nowadays Obesity, which is because again unhealthy food, sedentary lifestyle, delayed, disturbed sleep cycles. So all of this leads to PCOS, stress, the sedentary lifestyle, इतना mental stress है आज के lifestyle में. So these all factors leads to the problem that is PCOS. How to deal with it? Correct your lifestyle, healthy diet, regular exercise. It will again automatically it will lead to the regularization of your cycles. So it is very important. अगर फिर भी नहीं होता है तो you should take consultation from your doctor, from a gynecologist और फिर medications की help ली जा सकती है.
Thank you, Dr. Priyanka. You talked about PCOD. So maybe in continuation we can tell the girls what exactly is a normal menstrual cycle and what is an abnormal menstrual cycle.
So normal menstrual cycle is when you get your periods every month, like a span of 28 to 30 days for a duration of around 4 to 5 days, and menstrual जो blood loss है which is average, changing around 2 to 3 pads per day is okay. Means if we talk about in volume, it is near about 30 to 35 ml in a period of 5 days. If plus up duration में, like if you get plus 7 or minus 7, it is okay. But if more than that, then they are irregular. या फिर it persists for 10 days and every 15 days you are getting periods, or the menstrual blood loss is very scanty, or it is very heavy, like you are changing around 5-6 pads per day, clots are coming, then you need to see the doctor. There can be many reasons for that and they need to be investigated. So then we call it as abnormal cycles.
So you all are, I think, the Generation Z, aren't you? Alright, so the reason we are talking about these topics to both the girls and boys is because the Generation Z is supposed to be very gender sensitive. We know that you proclaim yourselves to be an open society, and the reason we talk about this is that this gender sensitization will help you deal with your friends who may be of the opposite sex, your siblings, especially your sisters, and you have to be very sensitive about these things, and you must take it very openly and understand what the problems are that are faced by girls during these times. All right? Dr. Priyanka, infertility is also another very common problem, and now these young adults, because of their lifestyles, irrespective of the sex, I would say, this problem is getting quite prevalent now. So what are the factors that are actually affecting this infertility?
Actually, this is a very important question. मुझे लगता है कि इस एज में ही हम जान ले तो it will help us in future. जैसा again and again we are talking about obesity, sedentary lifestyle, junk food. अभी आप लोगों को सबको पता है whatever food we are eating normally be adulterated है. So we talk about again and again we talk about eating healthy food, eating lots of antioxidants and fruits and vegetables. But तो वो भी adulterated है, but still they are better than the junk food. एक तो ये बहुत बड़ा reason है, जैसे जो lifestyle की वजह से obesity it is a big problem. अब obesity की वजह से मैंने बोला PCOS यानी कि egg regularly ovulate नहीं होगा तो उसकी वजह से pregnancy में issues आएंगे. So it can be a cause of infertility. I'm talking about females. Irregular cycles, so there can be a problem. ऐसा नहीं है कि treatment नहीं है, but yeah. Then STDs. What do you mean by STDs? They are sexually transmitted disease. So if we talk about in terms of आम language में अगर हम बात करें तो unprotected sex, which can be the reason of sexually transmitted diseases, and it can lead to various pelvic infections, and we have come across such patients. Pelvic abscesses बन जाते हैं, ovaries में पस बन जाता है, जिसकी वजह से the future chances of conception they became infertile. So it is a very you should refrain yourself from premarital sex and unprotected sex. You should not indulge into such things. After that, if we talk about males, smoking is prevalent nowadays in females also. So smoking, too much of smoking, too much of alcoholism, they should be avoided. Too much sedentary lifestyle, sitting continuously in front of the computer and laptop, prolonged periods of exposure to laptop. It is a very common. IT professionals जो होते हैं, इसमें बहुत ज़्यादा infertility common हो गई है. So again, this is a very common risk factor for infertility in future. Thank you.
As a doctor, no unprotected sex. But as an elder, I'm sure I'm older than most of you boys and girls' parents. As an elder, no premarital sex.
Thank you, sir. Dr. Mahek, we were just talking about, infertility issues and obesity. All these things have a, very severe, I would say, effect on our mental health. So maybe we can start talking about the mental issues in the young adults, related to initially obesity, and then we can come up to stress.
So all the senior doctors here, they have talked about so many issues pertaining to physical health, right? And physical health अच्छी होनी चाहिए. This is something we ourselves realize, doctors advise, parents advise. But how much does it happen कि we look back and think that how am I doing mentally? How am I doing emotionally? Am I feeling okay? Am I feeling good? Am I in stress? Do I need to talk to somebody about it? That doesn't happen a lot. So I want to start off by saying that जैसे हमें हमारी physical health का बहुत अच्छा ध्यान रखना चाहिए, हमें हमारी mental health का भी उतना ही equal अच्छे से ध्यान रखना चाहिए, because both of them go together. A lot of mental health problems can cause physical problems, and a lot of physical health problems can cause mental health problems. So there's a relationship between the two. Now coming to obesity, especially in young adults group, obesity के reasons जितने यहाँ पे डिस्कस हुए हैं, उसके अलावा इवन इमोशनल प्रॉब्लम्स, right, during childhood or during your age can lead to excessive food intake, excessive binge eating, and sedentary lifestyle and things like that, which can contribute to developing obesity. And अगर obesity का issue है, तो उसके साथ comorbid studies have said कि anxiety disorders, depression भी develop हुआ है. उसका एक कारण है body image issue. Because obesity की वजह से, weight gain की वजह से it can start happening that, we start feeling less confident, or there can be bullying, people commenting, peers commenting, family members commenting about your weight, about your appearance, which can, really get to you, which can, make you question your own self-value and make you, feel less confident about yourself. So these are some psychological problems that can happen because of obesity.
Can we have a quick word about stress in young adulthood?
Yeah. So stress is a big issue, and stress happens to all the age groups. But if I specifically talk about young adults, it's very much there. See, stress in itself is not a bad word, because stress भी दो तरीके के होते हैं. एक good stress होता है, एक bad stress होता है. You need some amount of good stress so that you are motivated to do your day-to-day tasks, so you can be be productive, you can study for the exam that you have. अगर exam का stress ही नहीं होगा तो पढ़ोगे कैसे? So या फिर you need to have that basic kind of a motivating factor, so that's good stress. Now when does it become bad stress? It becomes bad stress when you feel कि आप उससे बाहर ही नहीं आ पा रहे हो, आपको stress की वजह से आप physical problems, stomach problems होने लग गई हैं, या फिर even period related menstrual cycle delay हम देखते हैं stress की वजह से. उसके अलावा we are also seeing developing anxiety symptoms, घबराहट, restlessness. We अच्छे से एग्जाम के लिए प्रिपेयर किया है, but जब पेपर सामने आया तो blank हो गए. Why does that happen? It happens because of stress, and also sleep, नींद नहीं आ रही है stress की वजह से. Stress की भी causes अलग अलग होते हैं, especially आपके age group में. It can be related to career, competitive exam, comparison with you're comparing yourself with other people, body image issues, bullying हो सकता है कारण. Stress can also be caused by if addiction to any substance like alcohol, tobacco, even excessive use of social media can be attributed to stress. Managing expectations with parents, friendships में problems, relationship में problems. इस age group में commonly ये reasons हम देखते हैं stress के.
Thank you, Dr. Mahek. Dr. Mahek ने जैसे especially कहा कि addiction can be a cause of major stress. तो अब हमको ये नहीं करना है कि 1 घंटा परेशान कर दिया, चलो बाहर जाके एक सुट्टा लगा लें, है ना? Please don't do that. We are just coming to the end of the session, Dr. Lalit. I want you to address two topics. Number one, what are the cancers in young adulthood? And since we would be talking about a very dreaded subject, maybe you can wind up the session by telling the young adults how to be happy.
So I think first foremost about the cancers in adolescents. So it is like a transition between the childhood and the adulthood. So generally we do not see too much of cancers in the young children in your age. The most important part is that we all should be happy and healthy. So I think that part remains much more important for us, because आपका एज में किसी को भी मेडिकल प्रॉब्लम होगा तो जनरली पेरेंट्स बच्चे को ले जाते हैं डॉक्टर के पास में. दो तीन चीजें आपको इम्पोर्टेंट हैं. जैसा मैडम ने बताया स्ट्रेस. सो स्ट्रेस एक्चुअली है क्या स्ट्रेस? कैन एनीबॉडी टेल मी व्हाट इज स्ट्रेस? स्ट्रेस खाली चिंता है कोई चीज को लेके, कि यहाँ बैठे हुए हम घड़ी देख रहे हैं कितनी देर में सेशन खत्म होगा, इसके बाद क्या होगा, एसी थोड़ा कमजोर चल रहा है, कितनी देर लगेगी, पसीना आ रहा है, इसको एसी को क्या हो गया, पंखा क्यों नहीं चल रहा है. ऑल दीज टू स्ट्रेस. हम सड़क पे चलते हमको सामने लगता है कि आगे वाले अंकल जी ये फटाफट पार कर लेंगे तो मैं ट्रैफिक लाइट को क्रॉस कर जाऊंगा, और अंकल जी ने यदि गाड़ी लगा दी, मान लो हम जैसे उन्हें आगे रोक दिया तो मन में आता है क्या आदमी है, रोक ही दिया, गाड़ी में क्रॉस हो जाता है. हमारे सामने 3 ट्रैफिक लाइट आ जाती है एक साथ रेड वाली, हम सोचते हैं क्या तो पूरा दिन ही खराब है, बिल्कुल एक भी लाइट मेरे को ग्रीन नहीं मिलती. आज सुबह उठते ही कई बार तो ऐसा लगता है कि आज सुबह से मेरा दिमाग खराब है. तो वी नीड टू बी थैंकफुल टू गॉड कि हम लोग आज जिंदा हैं, हम लोग सामने, हम लोग इंसान हैं. हमको भगवान ने ऐसा दिया है कि हमारे पास सोने के लिए बिस्तर है, खाने के लिए हमारे पास अन्न है. वी शुड बी थैंकफुल टू गॉड. हैप्पीनेस वाली बात जहाँ तक आती है लाइफ में, आई थिंक 3 चीजें ज्यादा जरूरी है हमारे सबके लिए: हेल्थ, वेल्थ एंड हैप्पीनेस. सो फर्स्ट फॉरमोस्ट थिंग इज हेल्थ, एंड यू शुड बी हैविंग अ गुड हेल्थ. तो गुड हेल्थ काफी लोगों ने हमने आपको बताया व्हाट इज गुड हेल्थ. तो वी शुड बी हैविंग ए गुड हेल्थ नॉट ओनली इन योर एज बट थ्रू आउट द लाइफ. यदि अभी से अच्छी आदतों की नींव हमने डाल दी, फाउंडेशन डाल दी, आगे लाइफ टाइम आदतें अपनी अच्छी रहती है और हम ठीक रहते हैं. तो गुड हेल्थ इज वेरी इंपॉर्टेंट. वेल्थ ऑफ कोर्स सबको लगता है कि पैसा तो होना ही चाहिए जीवन में, लेकिन पैसा कितना होना चाहिए किसी को पता नहीं. सो वी ऑलवेज फील, बच्चे भी हमसे पूछते हैं सर सबसे ज्यादा पैसा कौन सी ब्रांच में मिलता है. मेडिकल में एमबीबीएस में एडमिशन के बाद जब पीजी में एडमिशन की बारी आती है, सर सबसे ज्यादा पैसा कौन सी मेडिसिन में है, सर्जरी में है. सो दिस ऑल कम्स इन आवर माइंड. इंजीनियरिंग में भी सेम थिंग आती है. सो वेल्थ इज इंपॉर्टेंट, बट कितना वेल्थ चाहिए वो पता नहीं होता. सो इन ए लिमिट वी शुड हैव दैट. एंड थर्ड मोस्ट इंपॉर्टेंट पार्ट इज हैप्पीनेस. हैप्पीनेस कैसे आएगी? हैप्पीनेस विल कम फ्रॉम इनसाइड. बाहर से नहीं होगा. हम सोचेंगे आज एक पिज्जा खाने से हैप्पीनेस आएगी, या मेरे पास बड़ी कार हो जाएगी तो हैप्पीनेस आएगी, या मुझे ये मिल जाए तो हैप्पीनेस आएगी. क्योंकि जब वो चीज मिलती है तब हमारी हैप्पीनेस का इंडेक्स बदल जाता है, एंड वी फील कि ये नहीं, इससे बेटर दूसरी चीज आएगी तो हैप्पीनेस आएगी. तो वी शुड बी हैप्पीनेस फ्रॉम इनसाइड. अपने अंतर्मन में हमको हैप्पीनेस रखनी है. हमें हर हालात में खुश रहने की कोशिश करनी है और आदत डालनी है. एक बार आदत डल जाएगी हमारी खुश रहने की, देन विल बी हैप्पी इन व्हिचएवर सर्कमस्टांसेस. अच्छा बुरा क्या फर्क पड़ता है. जैसे कहते हैं ना कि हर एक रात के बाद सुबह होती है, ऐसी कोई रात नहीं जिसके बाद में सुबह नहीं होती. सो ऊपर नीचे लाइफ में प्लस माइनस, अंधेरा उजाला सब चलता है. वी नीड टू बी थैंकफुल टू गॉड एंड वी कीप मूविंग फॉरवर्ड विद आवर पॉजिटिव एनर्जी.
Thank you, sir. So thank you so much, everyone. We will just wind up with.
एक बहुत इम्पॉर्टेंट टॉपिक और मेरा आई वांटेड टू टेल यू द यूज ऑफ ओवर द काउंटर अवेलेबल ड्रग्स. लाइक हम बहुत कॉमनली ये फेस करते हैं, बीइंग अ गायनेकोलॉजिस्ट, बीइंग एन ऑब्स्टेट्रिशियन. हमारी ओपीडी में बहुत सारी यंग गर्ल्स, बहुत सारी पेशेंट्स आते हैं, पीरियड्स डिले हो गए, जाके केमिस्ट के पास जाके कोई भी टैबलेट. हम प्लीज डोंट डू दैट गाइस, प्लीज डोंट. यू नो आई पिल के नाम से या एमटीपी पिल के नाम से या पीरियड्स डिले करने के लिए आप लोग जाते हैं केमिस्ट से पूछते हैं, वो आपको दवाई दे देता है विदाउट एनी प्रिस्क्रिप्शन. यू नो प्लीज डोंट डू दिस. इट कैन बी रियली लाइफ थ्रेटनिंग इश्यूज. हमारे पास बहुत सारे ऐसे पेशेंट्स आते हैं, ऐसे इंडल्ज इन सब चीज़ों में जाके टैबलेट लिया और फिर उनको ब्लीडिंग हो जाती है अंदर अपने एब्डोमेन के अंदर, और फिर बहुत डिफिकल्ट हो जाता है उनको ब्लड देना पड़ता है, उनकी लाइफ पे खतरा आता है. इसलिए अगर कुछ भी ऐसा है, कोई इश्यू ऐसा आता है, जस्ट कम टू अस. have a consultation, and then we will prescribe you the appropriate drugs. But don't use I-pill for the termination of pregnancy or delay of pregnancy. They can lead to problems like irregular periods or life-threatening ho sakta hai. Please don't do that. Okay?
Thank you, Dr. Priyanka, for addressing such an important issue. I thank all my panelists. Dr. Mehak would like to say something, and I would request Kapoor sir to give us a take-home message before we end this session.
I just want to say one more thing, that I talked about mental health, and I understand that even till now is topic ko leke there's a lot of stigma, there's a lot of apprehension to contact mental health professional, because people think कि सब सोचेंगे कि हमें क्या हो गया है, like हम पागल तो नहीं हो गए हैं, या फिर लोग क्या बात करेंगे. Please don't hesitate to contact a mental health professional if you think that you are having some kind of distress. You're all adults, and whatever information you share, a professional always keeps it confidential. So you don't have to worry that what you share will be shared by other people. If you go to the right professional, they will deal with you very ethically. So if any of you or you know somebody who needs mental health assistance, please do contact a mental health professional.